Thanking Dr. Rachel Levine, Secretary Levine, for her leadership and her service as Secretary of Health for Pennsylvania. I'm really grateful for her service, and I wish her all the best as a member of the Biden administration. And this is quite a coup for her and for Pennsylvania. This was not unexpected, and it's a great thing for her, but it's also a great thing to have someone who is as knowledgeable and has been as strong a leader for Pennsylvania working for us all in Washington. And that means also pleased to welcome Acting Secretary of Health Alison Bean and also the Acting Physician General Wendy Braund. We both have jumped into these responsibilities in a seamless way. And so, here we are just a few days after Secretary Levine left, and we are hitting the ground running. So I appreciate both of you for taking this immense responsibility and stepping in this very big shoes. Today, what we all want to do here is provide an update on the COVID-19 vaccinations in Pennsylvania. There are clearly a lot of challenges ahead of us, but I know that this team is more than capable of guiding us through those challenges. The highest priority for all of us right now is ensuring that we have an efficient and equitable and quick distribution of our vaccine, as quick as we can possibly make it. Of course, one of the challenges we face, actually this is the biggest challenge we face, is that we're not receiving enough doses of vaccine to meet the needs of Pennsylvania. Just to give you a sense of where we are, we have received about 1.5 million vaccines. And since it's a two-shot cycle, that means we have enough for basically 750,000 Pennsylvanians. There are over 4 million in the 1A category, 4 million people. That means we need 8 million vaccines. So at this point, we have a need for 8 million vaccines, and we have received 1.5 million vaccines. So one of the big constraints that we're all working under is the lack of supply, and that's facing states all across the country. That's frustrating, and it's a big concern for all of us. One of the things, and this is not just to point fingers, but the distribution of vaccines is really controlled, especially from the supply side, by the federal government. So there are a lot of things that we don't control, a lot of things we don't even know. We saw unpredictable allocations, and as you know, shifting guidance. I think we're in our 5th or so version of our own guidance here in Pennsylvania, but we saw shifts throughout the federal government in the last administration. The last thing that we saw was the prior administration asked states to expand guidelines for everybody, for those who could get the vaccines first, the 1A category. And the idea was, at least we thought, that meant that when we went to 65 and older from 75 and older, which really greatly expanded the range of 1A recipients, that the supply would also be expanded. Well, expanded. In fact, it turned out that there was no no stockpile that was going to be thrown open to the market. So it's been frustrating, and it's disappointing because we've all relied on the federal government, sort of this process to make sure that we have the vaccines. Here in Pennsylvania, I think we've fought really hard to make sure, and I think been successful along with other states, that we're getting our fair share of this limited supply. And our goal remains that whatever we get it out as quickly as we can. And we know that we can do a better job of doing this, but we are doing everything we can to make sure our systems and what part of this process we control, we do as well as we possibly can. I'm hopeful that the Biden administration is going to be able to put more efficient processes in place. They've already talked about increasing the supply and that they're going to give us better guidance in the future. With a better federal vaccine distribution process, vaccine distribution in Pennsylvania will absolutely move faster. And I'll continue to urge the Biden administration to make more vaccines available to Pennsylvania and to other states. Meanwhile, we are working to make sure that we're ready to distribute as many doses as we possibly can as supply increases. And while we wait for supply of vaccines to increase, just keep in mind there's still things that we all can do to make sure that we're staying healthy. And here are 4 things. First, Check in with your own doctor's healthcare provider to discuss your own COVID-19 risk. See if there's something that you're not aware of that maybe you have a risk that your doctor can help you with. Second, check the Department of Health's website for the most up-to-date vaccine plan and information. Again, we're on our 5th version, but the most recent versions, we keep putting them on our website, and we're constantly evaluating how our vaccine plan could be better. So wherever there are updates, we post them online. If you have questions or concerns, give us your feedback, because that could really help make this process better for all of us. Third, if you think you or someone you care for might be eligible for a vaccine right now, but you're not sure, go to the online website, pa.gov, and use our eligibility quiz to see if you are eligible. You just need to answer a few questions. And if you are eligible, the site also lets you know where you can go to get the vaccine. And fourth, please continue to practice the mitigation efforts that we all know work. Slowing the spread of COVID-19 is actually the best way that we can keep our families and our communities safe. And we've seen a real downturn in terms of new cases and deaths because Pennsylvanians have really taken this to heart and taken this responsibility to heart. So keep social distancing, wearing masks. Both those things really work. If you have any questions, download the COVID Alert PA, the app, and stay up to date on the transmission in your community. That really works. We have 750,000 Pennsylvanians signed up for that now. Again, I'm really proud of how Pennsylvanians have reacted, responded to this COVID crisis, this pandemic. And I know we'll continue, and we can continue to work together to make our communities safer while we're all waiting for this vaccine process to unfold. So thank you very much again. And now I'm very proud to turn it over to our new Acting Secretary of Health, Alison B.
Thank you, Governor, and thank you for the humbling honor of being able to serve as Acting Secretary. Thank you also to former Secretary Levine, who has provided me the privilege of being able to continue the Department of Health's mission of fighting the COVID-19 pandemic and keeping Pennsylvanians healthy. I'm honored to be entrusted to lead this incredible team that has worked tirelessly for nearly a year with the sole goal of saving lives. I've dedicated my own career to improving public health and access to healthcare. And I've been part of this team even before COVID impacted Pennsylvania, working to create a healthy Pennsylvania for all. This has made for a seamless transition, and we remain laser focused on saving lives and getting Pennsylvanians vaccinated. Now, I wanted to give you an update on COVID in Pennsylvania. As of 7 a.m. this morning, 3,887 people are hospitalized due to COVID-19 in Pennsylvania. 770 of them are in the intensive care unit, and 461 individuals are on a ventilator. The number of people hospitalized continues to decline, but is still above where we were during the spring peak. Today, we are reporting 4,628 new cases, bringing the total number of COVID-19 cases in Pennsylvania to 812,000. Of our total cases, the number of people who have recovered from COVID-19 is at 79%. 219 new deaths were tragically reported today, for a total of 20,883 deaths from COVID-19 since the pandemic started last March. The statewide percent positivity, as reported on the early monitoring dashboard, is now 10.5% statewide. This represents a continued decrease. Vaccine providers are reporting that they've administered 737,817 doses of vaccine as of this morning. There are 473,449 people who have received their first dose of vaccine, and 132,184 people who have received both doses and are fully vaccinated. We know that number is actually higher, but there is a natural lag in reporting because vaccine providers have 24 hours to report, and the federal and retail pharmacy partnerships have 72 hours to report. Pennsylvania is receiving 143,275 doses of vaccine this week to give people their first vaccination. Through the end of this week, the Commonwealth will have received more than 1.5 million doses of vaccine for individuals' first and second doses of vaccine. I know at times this data can feel confusing, especially when different jurisdictions are reporting different statistics. Our weekly allocation is only for 66 counties, as Philadelphia has received their own allocation. Federal installations are also receiving and administering their own doses. The most important thing for Pennsylvanians to remember is that vaccine providers are working as quickly as possible to vaccinate you. The demand for vaccine far outweighs the supply, but we will catch up. We must be patient. We know that Pennsylvanians are ready for the vaccine. We must have patience as the amount of vaccine available in Pennsylvania and the nation is limited. We want to ensure that the vaccine is provided to Pennsylvanians in a way that is ethical, equitable, and efficient, which is why we are taking our phased approach. We're asking all Pennsylvanians to know when it's your turn. This way, we can make sure that our most vulnerable residents can get vaccinated now. These are the people who are more likely to get very sick from COVID-19 and are more likely to die from it. If we can get them vaccinated quickly, we can save lives. While we are waiting, we must keep up our efforts to stop the spread of COVID-19 by masking up, washing up, and maintaining social distancing. Now I'm happy to introduce my friend and colleague, Acting Physician General Dr. Wendy Braund. Wendy?
Thank you, Governor and Secretary Beam. I'm honored to lend my clinical and public health expertise as Pennsylvania's interim acting physician general. I look forward to serving in this new capacity, helping the Department of Health and all Pennsylvanians save lives during this pandemic. My training as a preventive medicine physician, previous experience as the Wyoming State Health Officer, and current position as the director of the state's COVID-19 response effort give me a window into what we need to do from a public health perspective during a crisis. I have been impressed to see so many Pennsylvanians willing to make the sacrifices necessary to help each other get through this pandemic. With the vaccine rollout now happening across the state, we can see the light at the end of the tunnel. I want to specifically thank all of the local vaccine providers who are working hard to get the vaccine into arms as quickly as it is available. I repeat the call for patience as we move Pennsylvania forward. Thank you. Now, I'd like to introduce Randy Padfield, Director of Pennsylvania's Emergency Management Agency and a partner in the Department of Health's COVID response. Director Padfield.
Thank you, Dr. Braun, and good afternoon, everyone. I'm pleased to be here today with Governor Wolf, Acting Secretary of Health Bean, and Interim Acting Physician General Wendy Braund to discuss the evolving rollout of the COVID-19 vaccination program. The one thing that I'd like to bring to light is Governor Wolf indicated, we've all been working together throughout the COVID-19 pandemic. It's just now that we're in some different roles. Our agency continues to work with the Department of Health, other state agencies, county emergency managers, elected officials, and other stakeholders to plan and conduct community vaccination clinics in support of the rollout. Number one is to optimize the existing distribution systems by working with those healthcare systems, pharmacies, other vaccination providers, elected officials, and county emergency managers to ensure that they have the systems and needed resources in place to efficiently administer the vaccine that we are currently receiving across the state. Number two is to ensure an equitable distribution of vaccine into those areas of the state that have limited availability of vaccination providers, such as those counties that do not have healthcare systems and areas with a lack of current distribution pathways, or what we like to refer to as pharmacy deserts, by conducting community vaccination clinics for eligible individuals. And number three, to continue to build out and operationalize plans for community vaccination clinics of various sizes as additional quantities of vaccine become available and additional vaccines are approved by the FDA in the future. Currently, as you've heard today, we remain constrained by the quantity of available vaccine in order to support these types of administration pathways. But as the vaccine rollout continues, more vaccine will become available, and these types of delivery pathways will be required to reach larger numbers of eligible individuals in the later phases. Because of the diversity within the Commonwealth, we have highly urbanized areas, large suburban areas, and very rural areas. These plans will take several different forms, as no one approach is applicable throughout the entire state and able to address the needs of all communities. However, they will all follow a very similar approach and doctrine that we use in emergency management, in the fact that these will be federally supported, state managed, and locally executed. Having everyone working together in support of the rollout at all levels of government will be critical to the success of the COVID-19 vaccination program. We appreciate that this can be an extremely challenging and frustrating time for many individuals who currently qualify for vaccinations across the state and who are trying to set up appointments. This is undoubtedly the largest and most complex vaccination program ever initiated in the state, the nation, and the world. And it has several variables and interdependencies that have made for a very challenging initial phase and have impacted the ability to project significantly into the future. We have seen existing vaccination providers across the state continue to ramp the administration efforts since the inception of the program, and we continue to administer more and more vaccine every day. It will continue to get better as additional vaccines or quantities of vaccine become available, the provider network expands, and community vaccination clinics come online. We want the public to know that we collectively are committed to providing a safe and effective COVID-19 vaccine to everyone who would like it as part of the rollout. Now I'd like to turn the podium back over to Governor Wolf for questions. Thank you.
Thank you.
Thank you, Governor. First up is Aaron Martin from WPXI. Aaron, let's go ahead and unmute you. Go ahead and unmute, Aaron.
Hello, Governor. Thank you for taking the time to speak with us today.
Sure.
My question is in regards to the decision to expand phase 1A. We've received calls from people repeatedly over the last week saying they've spent hours on hold. They've repeatedly tried to get a vaccine and they haven't been able to. Were there any concerns that expanding phase 1A without the necessary supply would cause this confusion and chaos?
Yes. First of all, as I said in my remarks, we assumed that we were going to have an expanded supply when we went to the 65 and older, which expanded us to about 4 million plus people. And that didn't materialize. The other thing is that we still don't have anywhere close to 8 million doses that we need. So even if we were getting the injections into people as immediately, we'd still be far short of satisfying the demand that's out there. So inevitably, there are people who have not been able to get the vaccine at this point, even though they're in the 1A. Second thing is, as we're ramping up, we have, I think, about 1,000 locations around the state that are set up to actually do the inoculations. They're relying on their phone systems, their own websites, and some of them are great. Some of them just are not up to the challenge of the huge influx of calls and connections that they're getting. So we have a lot of work to do. We want to do a much better job than we're doing, and we will continue to improve this process. But again, we do have some constraints that we're all working under that all make it necessary for us to make sure that we're managing our expectations, given the reality that we have far less supply than we hoped we would have at this point. Given the fact that, as you pointed out, we expanded the list in 1A, we have more people who really are in line right now to get the vaccine. Those two things lead to shortages, lead to longer wait times.
And Governor, just to quickly follow up on that point, when the announcement was made last Tuesday to expand phase 1A, it was understood that there would only be about 140,000 doses for that particular week. Was there any thought that the state should wait to expand until they actually had more supply, as opposed to assuming that could come?
That's a good question, but no, we didn't think about that. We wanted to make sure that we were getting people, and we still, the idea is to get people in line in terms of the need. And I think we're doing that. Again, we're constrained by the supply. And I will do everything I can to encourage the Biden administration. I know they're doing everything they can to increase the supply. And as we do that, I think some of this will ease up. But the idea was to look at need and then to make sure that we do everything we can to take whatever supply we have and get it into the arms of people who need it.
Next up, Samantha Zern from PLS. Go ahead, Samantha. Samantha, would you like to ask a question? Okay, looks like we're having some technical difficulties. Sam, are you there?
Can you hear me?
Yes, we can hear you, Sam.
Thank you. Okay, so this is a question for Director Padfield. I'm wondering if we could get a few more details about the community vaccine centers, particularly with regards to when we'll know where those will be located and how they're going to be staffed.
So that's a very good question. So as I indicated in my remarks, there are going to be various solutions. So we're really taking a look at right now the quantity that is coming into the state, so the vaccine that's allocated, and we're really taking a look at a very short time window to be able to stand up some of these centers, because we really can only project out about 2 weeks right now what our vaccine quantities are going to be. So the information on any of the clinics that are going to be staffed is going to be released multiple ways. Predominantly, it's going to be released through social media channels, through working with our counties and our elected officials to get information out. It will be available on the Department of Health 1-877 number, and all of the distribution pathways we normally distribute information regarding that. From a timeline perspective, again, a lot of these, we are working on clinics right now, and they are really focused on operationalizing and optimizing what is out there currently. So we know a number of counties are working with their healthcare systems that have quantities of vaccine that are willing to support larger clinics, but may not have all of the resources or wraparound services they need. So we're working with them right now to be able to plan those and to be able to utilize the vaccine stores that we have now to be able to actually get those into people's arms, and then also look to expand that as we get additional vaccine. But as I indicated, it's very difficult to project into the future because we really only know what our allocations are about 2 weeks in advance.
Next up, Jan Murphy from Penn Live. Jan, go ahead and unmute.
Hi, Governor, and thank you for doing this. I was wondering, Secretary Beam said she's asking all Pennsylvanians to know when it's your turn to get vaccinated. Why did the state decide to not do what other governmental agencies have done, or entities, I should say, have done in allowing people to pre-register for vaccinations to give people an idea on when they may be eligible and where they could get the vaccination, as Senator Lindsey Williams is calling for? Knowing when it's your turn doesn't help you find out when and where you can get a vaccination.
Yeah, actually our website, if you look at it, does have a way that you can go and work directly with one of those 1,000 organizations out there that have been set up to dispense this to that first group. We don't have the registration, but I think you answered that question with Senator Williams this morning. So you want to?
Thank you so much. And this is a question that we have been wrestling with, but our underpinning principle in making sure that the vaccine is getting significant uptake in Pennsylvania is having a localized effort. The relationship that folks have with their suited to actually administer the vaccine. And so we are allowing those providers and those pharmacists to be able to use their scheduling systems that they might have already had in place or that they invested in to be our ultimate registration guide. With that being said, we have not at all abdicated our responsibility in making sure folks have the adequate information about where they can go get vaccinated. And as the governor alluded to, we have a website that steps folks through how they can identify a provider in their community, contact them, and schedule their appointment as they see fit.
if I could just quick follow up another issue that came up last week with corrections officers and state troopers unions, and we've heard school employees say too that they're upset that smokers are considered at risk in the at-risk group that are allowed to jump to the front of the line. And I was wondering, just because the CDC recommends that, does the state have to follow it?
No, the state does not have to follow CDC guidelines, but we're trying to recognize people who have are vulnerable to the COVID, and it turns out that smokers actually are. So the CDC is not making a value judgment there. They're making a very objective healthcare decision that if you're a smoker, you are predisposed to certain pulmonary problems that make you a prime candidate for getting a severe case of COVID. So that's what was driving that out. Alison, if you want to add anything to that.
Sure. So our underlying mission this entire time has been to save lives. And as part of that, in thinking through the calculus of the vaccine order, we had to be able to make sure that those most at risk were prioritized. And so moving those individuals into 1A, as the governor mentioned that the federal government had released guidance to do so, is indicative of the risk that they all pose. With that being said, we know our firefighters and our teachers and our corrections officers are dedicated public servants that have been frontline workers in their own right during this pandemic response. And we look forward to working with them as we progress through our phased response to allow them to avail themselves of the vaccine as quickly as possible. We'll do so, I think, best by advocating to the federal government for more supply. We still need to be patient while we work on advocating for more vaccine supplies so that we can move through these phases as quickly as possible.
Next up, Harry Lee from Fox 43. Harry, go ahead.
Hi, this is probably also for Acting Secretary Beam. Just going back to the centralized registration system, other states are taking that on, such as Ohio and I think New Jersey. You say that it's more efficient for it to be done on a local level because they already have scheduling mechanisms in place, but it seems like it's kind of chaotic. Could you just explain more why you don't want to do a centralized registration system?
Sure. So we have been working since the beginning of the pandemic response. The hospitals, the pharmacists, the FQHCs, they've all been our providers throughout and providers throughout this entire response. And I think in our partnership, we've realized that they also have made investments into scheduling systems and into infrastructure that we hope will allow us to also come out on the other side of the pandemic with a better infrastructure built to allow people to access their clinicians. But allowing us to have that localized relationship really, I think, is the ultimate goal in making sure that Pennsylvanians continue to keep the interest in the vaccine and we actually secure that critical mass being vaccinated as quickly as possible.
Okay, I do have a quick other question. Are Pennsylvanians allowed?
Could I just add something to that? I mean, I think right now Pennsylvania is in the middle of the pack in terms of, according to the New York Times, last week we were a little higher than we are this week in terms of actually our efficiency in getting injections out. So we recognize that we need to do a better job. I hate being in the middle of any pack. I want to be at the top of the pack, and we're going to continue to work together. If the registration system is something that might get us there, we'll certainly give that serious consideration. Right now, because that has its own, I would imagine, its own backlog and bureaucratic issues if in the states that do that. I think as each of these 1,000 entities ramp up their capacity to take calls, and we get more supply of vaccine, that this system will do a pretty good job. But there's no question that we need to do a better job. So I'm sorry, you were going to ask a follow-up.
Thank you, Governor. I just had one question. Are Pennsylvanians ever allowed to go get the vaccine in another state? We've been getting that question.
Pennsylvania does not prohibit that, but other states are beginning to prohibit that. I think they call it vaccine tourism. I know Florida has outlawed that. I think some other states have. So from going to another state and getting a vaccine, but other states are saying, you know, we don't want you to come here for the purpose of getting a vaccine.
Next up is David Wenner from Penn Live. David, go ahead and unmute.
Thank you. Does the state know of any instances of people inside pharmacies or hospitals steering doses towards people such as friends and relatives, as opposed to the people who are trying to register from outside. Does the state know of that happening? And what's the state's level of concern about that? And what, if anything, would prevent that?
Yeah, I don't know of anything, but I'm going to turn that over to Secretary Beam. Do you know of any?
Absolutely. At this time, we are not aware of any of those instances, but at the ultimate end of the day, we want to make sure that we have that continued communication channel. And so if there are instances of that happening, we welcome all feedback, and please reach out.
And I would just like to follow up then. Is there any auditing that could actually be used to, check that out if it became necessary?
Absolutely. Our team would be able to audit and follow up on it. I think that ultimately where we've looked at the ability to have any vaccine wasted to date has been focused on any of the broken vials, making sure that if there were any sort of actual struggles within the delivery of the vaccine, that is accurately reported, but our team would be able to follow up on any allegations that you had articulated.
Next up, Nick Volturo from CBS 21. Nick, go ahead and unmute.
Governor Wolf, you talked a little bit about lagging behind some of the other states. If you had to point the finger at something that you would say has been contributing to that, what do you think the biggest factor has been to kind of impact the slower rollout?
That's what we're trying to figure out. Again, it's slower. It's a relative term. I mean, we're in the middle of the pack, so we're not doing that bad. But I always want to be at the top of the pack. So I think we're trying to figure out what we can learn from what's happened so far, and learn from other states. I'm going to be on a call with other governors at 3:00 to learn more about what other states are doing. And we're always, I know the secretary, the director, we're always trying to steal good ideas from elsewhere. So if we learn that there are things that we're not doing that might be done to make this go faster, we will do that. Again, the chief problem, you always have to come back to the fact that there are 4 million people in need of over 8 million shots. And so far, we've gotten about 1.5 million. The supply is, no matter what system we have, that is the primary constraint that we're operating under. Within that constraint, we want to do the best job we possibly can. And if we can get good ideas inside Pennsylvania and learn from what we're doing, learn from other states, we'll do that. You want to
So would you say, just to follow up real quick, would you say that all hinges upon, the federal government and the speed of the production? I mean, everything kind of trickles down in that matter. So it kind of falls on you no matter what from the top.
Yeah, again, yes, the chief constraint we're all operating under is the supply. But then no matter what the supply is, then it's up to all of us, each state, to figure out what's the best way to get it from the vials, whatever we get, into the arms of people. And that's where we're doing everything we can to make that go as fairly, as quickly as possible. And we know that we can do better because other states are ahead of us there. And so we'll try to do better here in Pennsylvania. Secretary, you want to add anything to that?
Sure. So Pennsylvania absolutely is open to deploying different strategies. We have a team that explores what other states are doing, where there's advisements on pivoting and what we're currently doing. We're always open to that. One of the things that we must remember, though, is that we are doing this in partnership with our healthcare system. These are the same healthcare workers who have been dedicated frontline workers since the beginning of this pandemic. And so we're grateful for their partnership in making sure that there is that access to the vaccine. Additionally, we're exploring the other federal channels, making sure that we partner with folks like Rite Aid and Topco, which I know folks have spoken about before, to have a retail route for availability. but we are also doubling down on our effort to invest in our long-term care facility vaccinations. We think that that is part of a long game strategy to allow us to make sure that the populations that are most vulnerable throughout this entire pandemic, those in the congregate care setting, have their vaccinations and secure that second dose as quickly and as efficiently as possible. And so we want to make sure that in prioritizing our staged rollout and throughout the various phases, we are always open to hearing suggestions as to how to do it more efficiently, but we want to make sure that we're also effective in addressing the populations that are most of need.
Next up, Sam Ruland from the York Daily Record. Go ahead, Sam.
Hi, thank you for taking my question today. I had two questions, and one of them was, I was wondering why some counties didn't receive the vaccine until week 5 or 6 for distribution, at least what it looks like. And I just wasn't really sure what some of those lags were.
I don't know the answer to that question. Let me turn it over to Secretary Bean.
Hi, I actually would be welcoming of any more information that you have about which specific counties you're looking at. We have a distribution strategy by which we review each county and make sure that we not only consider their population, but also their population over 65, the number of cases, and the number of deaths from COVID. So we have an accurate picture of the risk in the community and then allocate from there. And so please feel free to follow up with our press team with any details, and we can understand better the information that you're looking at. But we hope that in doing our county allocation based on those factors broadly, we're able to distribute it across the Commonwealth as quickly and as effectively as possible.
Great, thank you. And then my other question was just in regards to nursing home residents. I did see kind of based on the CVS and Walgreens efforts, what Philadelphia has been able to accomplish with doses and kind of administering that. But I wanted to know on a statewide level where we were with vaccinating nursing home residents.
Let me turn that over to the Secretary.
So through that federal partnership with CVS and Walgreens, they have embarked on a mission to meet long-term care facility residents where they are and get them vaccinated. We've been grateful for that partnership and have worked very closely in addition to allocating a concentration of our vaccine supply to them for that mission. Thus far, they are on a timetable for completion towards the end of February, though we have also created another channel for long-term care facilities to get vaccinated if they didn't qualify for that CVS and Walgreens affiliated mission. And so we'll be working on 2 different tracks to make sure that individuals that are Pennsylvanians that live in long-term care facilities can be reached as quickly and as efficiently as possible with the vaccine.
Next up, Mark Hall from ABC 27. Mark, go ahead and unmute.
Thank you, and thank you, Governor, for taking my question. What is your reaction to reports? We're getting a lot of calls of people that are going to neighboring states to get vaccinated or at least get that first dose. Not sure how they can guarantee they get a second dose, but what is your reaction to people going to other states? And 2, it was either you or Secretary Beam who indicated that you would consider maybe some sort of a sign-up program if needed. What would have to happen for that to be considered? Again, the first question is your reaction to people going to neighboring states to get vaccinated.
Yeah, first of all, every state, I'm convinced every state is being fairly allocated whatever limited supplies of vaccines are out there. The formula is based on population, and so Pennsylvania is, I think, getting its fair share of vaccines. So I'm not sure why you'd go to another state because we're all facing the same thing, unless there's something that I'm not aware of. But the systems that we're deploying here again put us in the middle of the pack, and unless there's something that is really unbelievably good about the efficiency of some other state, I'm not sure you gain anything from doing that. Again, we're, as the Secretary said, in terms of how we do our own allocation internally with what limited supplies we get, we have continued to look at anything that we can to make our system better. At this point, we're looking at these almost 1,000 points all around the Commonwealth, and we're relying on their internal processes. They're localized. They should know their customers, the people they're serving, better than one centralized registration place. But again, if we get evidence that there is some alternative to this decentralized system that we have in place that could be better and be more efficient, more than willing to consider that. Alison, do you want to add anything to that?
Sure. So I think the question was, how do you feel when you know that Pennsylvanians have to travel out of state to get vaccinated? And I think the accurate answer is it feels like we have to rise to the challenge. We don't want Pennsylvanians feeling like they have to go out of state to get vaccinated. We want to make sure that we can secure them swift access to a vaccine here in Pennsylvania. And hopefully through the strategies that Director Padfield and the governor had outlined today, we'll be able to do that in the near future.
Thank you.
Mark, do you have a follow-up or okay? And our last question, Hayden Mittman from PBS 39. Hayden, go ahead and unmute.
Hi, thank you very much for allowing me to ask a question. I wanted to ask about the incoming Biden administration. I know it's only about a week in. How have you noticed a relationship between the federal government and the state government in dealing with the vaccines? Is it easier, I guess, to talk up to the federal government about the lag in vaccines here? And are things going to get better moving forward?
Okay, I'm going to give you my impression, then I'm going to turn it over to the secretary. As I said, in about 15 minutes, I'm going to have the second call in 2 weeks with the other governors and the administration. And today, the discussion is pretty much all about vaccines and how we can do a better job of getting these vaccines from the federal, from where they're manufactured to the states and into people's arms. This administration has, in now a week, has seemed to me to be very interested in connecting with some very practical things as to what states can be doing. In terms of the overall process of increasing the production of this, what I have learned is what I see in the press, and that is the Biden administration was originally talking about 100 million doses in the first 100 days. It's now up to 150 million in the first 100 days. And again, I'm not sure exactly how they plan to do that. There are all kinds of challenges in increasing production. I think the Kaiser Family Foundation's newsletter had an article piece on that just recently. But they seem to be making a big effort to do this, and I give them real credit for doing that. In terms of some of the details, so let me turn it over to the Secretary of Health for exactly how you see this process.
So we're grateful that the Biden administration, throughout their orientation into office, has reached out in different various forums to allow us to give candid feedback of our experience to date. The ability to have that open channel of communication will be critical throughout this rollout and then future pandemic responses, to be able to have real-time feedback and I think actionable plans on their part that we feel are clearly communicated to us too. So we're grateful for that. And actually, Director Padfield, I think you have had some contact as well. Do you want to offer any comments?
Sure. We have, from the Federal Emergency Management Agency perspective, we have had continuing communication with them regarding their role and their changing role in the vaccine administration and rollout. So we've had some positive news in the last week or so regarding, obviously, the ability to be able to staff 100 large mass vaccination clinics throughout the nation. And we're working right now with our federal partners to be able to take a look at what that means, what the throughput happens to be, and the best placement of those centers moving forward. So that is a step in the positive direction. We know that FEMA is working extremely hard in support of the states to be able to ramp up commensuratively. They were there in the beginning part of the pandemic, and now they're coming back into focus again to be able to assist with the logistics and to be able to really go back to the, federally supported, state managed and locally executed doctrine that we use throughout all of emergency management.
Director. Thank you, April.
Thank you, Governor. That concludes our press conference for today. Our recording will be available on pacast.com.